Okay, so this is the first of the kinesthetic learning exercises. We're going to be drawing the musculature onto the vertebral column. This image should be available to you through the D2L site. You can either print off, I'd recommend a number of copies because you're going to want several of them for all the different muscles you're going to be drawing in. Alternatively, if you're using, for example, an iPad, I know has some very good drawing software, so you can have multiple copies of the images pulled up on your iPad and just use your stylus to draw the structures in. First muscle that we're going to be starting with is the trapezius. Now, if you look at the description within the notes, it talks about the origin being the superior nuchal line, external occipital protuberance, nuchal ligaments, spinous processes of C7 through T12. This is why I don't like memorizing origin points, because when you think about it, this is your superior nuchal line, here's your external occipital protuberance, that's the nuchal ligament, and as we continue down, these are the spinous processes of C7 all the way through C12. So they're a really complex sentence to really describe essentially a straight line with a little tip at the top. Insertion point, same sort of idea. Comes off of the lateral third of the clavicle, the acromion process of the scapula, and the spine of the scapula, which once again is just this straight continuous line. And from there, we just really have to connect the dots in place. So what you'll notice is it's a fan-shaped muscle where all of the fibers are converging on one point. So as a result, it's going to have different functions depending on which fibers are contracting. So if we contract specifically the superior fibers that I'm drawing in now, that's going to cause elevation of the scapula. If you contract the middle fibers, which are currently being drawn in, that's going to create scapular retraction. It's going to pull the scapula back. And if you more selectively contract the inferior fibers, which are being drawn in at this point, then that's going to result in depression of the scapula. So different functions depending on what's being actually contracted, which of the fibers are actually being contracted. The other thing to note at this point is that the innervation is the accessory nerve, one that you'll be seeing a little bit later on. Next muscle that we're going to draw in is the Latissimus Dorsi muscle. Latissimus Dorsi originates once again off of the spinous processes, in this case of about T6 or T7 spinous process all the way down through T12 again and through the lumbar as well. So you're noticing that we've got a little bit of an overlap here, and it's actually going to be underneath trapezius. So what we'll actually do is use dotted lines to show how it's underneath trapezius. Now, we talk about it originating off of all of these spinous processes, but the muscle itself, the fibers don't actually originate off of the lower spinous processes. Instead, it's an incredibly long, broad tendon, which is given its own name, the thoracolumbar fascia. And so what we have instead is we usually draw the muscle kind of swooping down at this point. And this is where you can see its origin. So this is all a broad tendon, once again called the thoracolumbar fascia that we see. And these points sort of connect up. So the fibers themselves start right above the thoracolumbar fascia. And as they project through, we're going to notice that they all once again will converge on a single point, in this case what's called the medial lip of the intertubercular groove. That's found on the anterior surface of the humerus. You're probably all familiar with the biceps brachii muscle. It has a long tendon which runs up in this region here on the anterior surface, and it sits in a little groove on the anterior side. And so just medial to that groove we have this lip, and that represents the insertion point for Latissimus dorsi. So we can now start to draw the actual fibers coming in and once again converging on this point. It's important to note that you'll see it kind of passes over the clavicle in this spot. It is very common for Latissimus dorsi to actually attach some of its fibers to that inferior angle of the scapula, so don't be surprised if you see that in the lab. In addition, you'll also see some of the fibers which will actually attach to different areas of the lower ribs, so it does have quite an extensive attachment point. So we can continue drawing those in. So this is the muscle that causes primarily adduction of the arm, but it's also going to, because it extends towards the anterior, it's going to be allowed to contribute a little bit to internal rotation of the humerus as well. Next muscle to discuss is Levator Scapulae. I'm going to be drawing this one in black. Levator Scapulae originates off of the transverse processes of C1 through C4 generally, and it's going to insert itself on the medial border of the scapula. So when we connect these fibers down, that's the route it's going to take. I think the action of the muscle is pretty self-explanatory. It's going to elevate the scapula. As well, it's going to cause a little bit of rotation within the scapula so that the glenoid lip, the glenoid labrum, is actually going to rotate downwards because of its pull in that situation. But primarily it's elevation of the scapula along with the upper fibers of trapezius, so it creates the shoulder shrug expression. Next two muscles that we're going to be discussing, we talk about them together because essentially they serve the same function, and really it's very difficult to actually distinguish them, and you may not be able to actually in lab. Those are the rhomboid minor and the rhomboid major. So when you look at these in lab, sometimes they're completely blended together, or sometimes the minor might not even really be existent at all to speak of, or just a very, very minor insignificant slip. But they have similar origin and insertion points and similar action. So we're just going to talk about them together. So I'm going to do the minor in blue and the major in red again. My apologies, I only have a certain number of colors on this palette to work from. Minor comes off of T1 and a little bit further up off of C7. Sometimes it talks about it coming off the nuchal line. Whereas the major, actually I'll show the major in black to give a little bit more of a distinction here. It comes off of T2 all the way through T5. So when you look at these two muscles, it's basically one long continuous origin point off of T1 and a little bit into C7 and the nuchal line all the way through T5. When we look at the insertion, it's going to be along the entire length of the medial border of the scapula. So it essentially runs in this parallel direction all the way through. So these would be the fibers for the minor inserting down. And then when we switch over and draw the major, same sort of thing. They run completely parallel. And this is why these muscles are so hard to distinguish, is because the fibers really just sort of blend in and run in the exact same direction. Because of the way they run, they're going to, once again, assist with scapular retraction, and they're also going to be involved in holding the scapula flat against the thorax, along with some of the other muscles we'll be talking about. To discuss the next two muscles that we're going to be looking at, first thing that we need to do is wipe the slate clean, or start with a brand new page. It's getting a little bit deeper, and it's getting a bit gunked up, so for these next two, we're going to start with a fresh page. The next two, once again, have fairly similar appearances and similar names, which is why we discuss them together, but they aren't quite as closely packed together as the rhomboid, so you'll be able to discern them hopefully in lab. And these are your serratus posterior superior and serratus posterior inferior. Term serratus relates to a serrated edge, so these are two of three muscles that actually insert onto the ribs, and because of the segmental insertion points that we see, it almost looks like a sawtooth appearance, hence the name serratus. Incidentally, the third muscle is the serratus anterior, which we'll be talking about at a later date. So we'll start with serratus posterior superior. I'm going to do it in blue here. So once again, it's going to be an even deeper muscle that again comes off the nuchal line and the spinous processes of C7 through as far as T3, although that's a little bit variable and a little bit speculative. So T1, 2, and 3, we'll do it from there. And this is going to come down and insert on ribs 2 through 4 or 5. So we'll just draw it going through ribs 2 through 4. The sister muscle to this is serratus posterior inferior. I'm going to do it in red. So this comes off of spinous processes of T11 through L2. And then it's going to come up and insert on the inferior borders of ribs 8 through 12. So that'll be good enough. And when you actually draw this in, and you'll see this a bit better when you see it in lab, it does have that serrated sort of appearance off of the end, which is the reason for its name. Function of these muscles, if you look at the classical text, it talks about the serratus posterior superior possibly elevating the ribs during forceful inspiration, and the serratus posterior inferior possibly depressing the ribs during forceful expiration. But when you see these in lab, if you're able to see them at all, they do show up in muscular individuals. So there possibly is something to that. But when you look at frail elderly individuals, for example, these things are paper thin, and sometimes they blend in so well with the surrounding fascia, you may not be able to identify them in these individuals. So their actual role and their overall function and value is very speculative. Some people believe they actually might serve proprioceptive functions, where they just are able to give information about the orientation of the vertebral column relative to the thoracic cage. Time to begin our second kinesthetic learning exercise, this time looking at the intrinsic muscles of the back. So again, these are the ones that originate off the vertebral column, insert on a different region within the vertebral column, and so have a direct effect on movements of the axial skeleton. First one that we're going to be looking at is a muscle called splenius. So splenius is going to come off of the spinous processes. In the cervical region, it comes off of that nuchal ligament, and then C7 all the way through T3 or T4, give or take. And the fibers are going to run up laterally and will attach to the transverse processes of cervical vertebrae 1 through 3 or 1 through 4. So these are how some of the fibers are going to attach, but in addition to those, we do actually see some fibers which project all the way up to the mastoid process on the base of the skull. So we do have a collection of fibers that will run to the skull itself. And then this is going to be a common theme that we're going to be seeing with a lot of these intrinsic muscles. When you get into lab, you're going to primarily see the superficial muscle fibers running into the mastoid process. So we would call these the splenius capitis portion of the muscle, meaning the fibers that attach to the head. The deeper fibers, which you're really going to have a difficulty finding and probably you're not going to be spending too much time to try and really locate, are called splenius cervicis, identifying that their insertion point is on the cervical vertebrae rather than the base of the skull itself. Bilaterally, they're going to cause extension of the cervical spine, and if you contract unilaterally, meaning if we only contracted this one right side, it's going to pull the head and the cervical vertebrae down into lateral flexion to the same side. We call that ipsilateral lateral flexion. Next few muscles that we're going to be talking about are all collectively known as the erector spinae, so named because they help to maintain the spine in an upright position when we're sitting up or standing. Three muscles all originate off of the sacrum and lumbar vertebrae to a degree where they fuse together and really are indistinguishable. But as you travel upwards, you are able to make out very distinct muscles, especially if you work into it with your hands to be able to separate them. So the lateralmost one is called Iliocostalis. So this one is going to come off of the lateral aspect of the sacrum and is then going to project up and attach, as the name implies, to the ribs. So that's where it gets its name from, Iliocostalis. It does have a portion which does come off the ilium itself, and then the fibers are going to project up to varying regions along the rib cage. Again, as we saw with splenius, depending on where they attach, we have the iliocostalis, thoracis, which attaches in the thoracic region, lumborum, which is going to be really far down in the lowest rib, and you do end up with some cervicis that will actually come up and attach to the cervical spine, but again, I seriously doubt that you will be able to necessarily identify those fibers in lab. You basically lose track of iliocostalis right around the region of the scapula. Next muscle to identify is Longus Imus. It's the intermediate muscle. It gets its name from the fact that it is the longest discontinuous muscle in the body. So what is meant by that? Well, if you look at these fibers, it's not like we have single muscle fibers which are extending from the sacrum going all the way up to the base of the skull, which is what we're going to see in the case of Longus Imus. What's actually happening is, as we go along, you'll notice that there's actually fibers which originate, in this case, off of some of the ribs, and then insert a few levels up. So the fibers themselves are not necessarily that long, but when all of these different individual fibers are bundled together, they collectively create what is the longest muscle in the body. So once again, we have thoracis representing fibers in the thoracic region, and then cervicis, fibers that will actually attach onto the vertebrae. And then we even have capitis. So we do have some of these fibers which once again will reach up and attach right along the aspect of the mastoid process, all the way further up. Again, when you get to the top, it's going to be a little bit difficult to distinguish the thoracis from the cervicis, from the capitis, but especially further down, it will be fairly easy to distinguish Longus Imus from iliocostalis when you separate it through with your fingers. The third muscle in the erector spinae group, and the most medial, is known as spinalis. It gets its name from the fact that it comes off of one spinous process and attaches typically 1 to 2 levels further above where it originated from. So once again, gives you this idea of it being a discontinuous muscle with fibers inserting. Some of the lower fibers will actually insert below where some of the upper fibers originate. Disappears underneath splenius, but emerges and once again will reach all the way to the base of the skull. So we'll have spinalis, thoracis, cervicis, and capitis, depending on what region we're talking about. Okay, the next group that we're going to be looking at are the transverse spinalis muscles. So again, I would recommend starting with a clean sheet to help identify these. And I'm just going to erase and start from here. So when we look at the transverse spinalis group, the name kind of says it all. Originates of a transverse process and attaches to the spinous processes. We divide them into three depending on whether it's a superficial, middle, or a deep group that we're looking at. So the first are the semi-spinalis fibers. They're found to a much larger degree in the superior region, and once again they're going to be on top. So when we actually draw this in, it's typically coming off of the transverse processes of thoracic vertebrae through the cervical vertebrae, and they swoop up about 3 to 4 segments apiece, and they attach to the spinous process. So that's where the name comes from. When we had spinalis, which goes from spine to spine, semispinalis goes from transverse process to spine, and some of the uppermost fibers will actually attach to the base of the occiput, so those would be semispinalis capitis fibers that you would be looking at in that case. Second one is multifidus. It's a little unfortunate that I'm drawing it in second because there is a bit of overlap with semispinalis and multifidus, and where they overlap, multifidus is actually deep to semispinalis. So again, off the transverse processes, and we see actually a very thick region that comes off of the sacrum. So this is going to be a fairly thick muscle when we remove the erector spinae that, once again, similar to semispinalis, is going to go from transverse process up to attach to the spinous processes, spanning about 3 to 4 segments again. The third one's a little bit of a unique muscle. It's called rotatories. I'm going to draw a few of these in. So these are going to be the deepest of the transversospinalis group, and you always see the same sort of pattern. We have a transverse process here, so we have a set of fibers which will go across to the spinous process of the vertebrae just above, and then we also have another set of fibers which will run to the spinous process 2 above, and you always see it in this pattern. Spinous process 1 above, spinous process 2 above, spinous process 1 above, spinous process 2 above. And so those are the rotatories. So in lab, in practice, you're going to have a difficult time distinguishing between semispinalis and multifidus to begin with. It will be very tricky to identify individual rotatories, but you have to take my word for it. They are there. I have seen them in the past, and if you're ambitious, take a couple of minutes and see if you're able to dig them out. Just let me quickly throw up the labels there. My apologies for that. So again, semispinalis shown in blue, multifidus in red, rotatories in black. As of the day is looking at the suboccipital region and identifying the muscles and the associated structures within the triangle. First muscle we're going to identify is called the rectus capitis posterior minor. Comes off of the posterior tubercle on the posterior arch of C1 and attaches, well, it's a little bit high up, it attaches basically to the inferior nuchal line on the base of the skull, so a very, very small, short muscle in this situation. Next muscle to be aware of, if we have a rectus capitis posterior minor, we probably have a rectus capitis posterior major. And in this case, the muscle is actually going to originate off of the spinous process of C2. So whereas the minor came off of the posterior arch of C1, major comes off of the spinous process similar area of C2. And once again, it's going to have a very similar attachment point just out a bit further lateral to where the minor happened to attach. Third is our obliquus capitis inferior. So this is a bit of a misnomer in that it has capitis in its name, but it doesn't actually attach anywhere to the skull. It comes off of, again, the spinous process of C2, and in this case it's actually going to reach up and project and attach to the transverse process of C1. And then fourth and finally, we have the obliquus capitis superior, which again comes off the transverse process of C1, and this one is going to attach to the base of the occiput, very, very close to the rectus capitis posterior major. So if we look at the rectus capitis posterior major and our two obliques, we can see that these create a triangular pattern that we call the suboccipital triangle. When you actually see this in an individual, again, this is where we make it look more realistic, or we try and make it fit a triangular pattern. When you actually see it in lab, it'll actually look more like a circular structure with these muscles really cramped together, and when you try and separate them, you're only going to get a very, very little window. But because it is three muscles, we do call it the triangle. Reason for the importance of the suboccipital triangle and using this as a landmark is there's a number of important structures that we can identify that are associated with this region itself. First one to talk about is the vertebral artery. So the vertebral artery, as we've already talked about, it bypasses the C7 foramen transversarium, but then it comes up and it's actually going to run through the foramen transversarium of the remaining cervical vertebrae all the way up to C1. And takes a bit of an odd route at this point. After it gets to the foramen transversarium of C1, it's actually going to come across at about a 90-degree angle and then hook up and actually enter the base of the skull through there. So I've drawn on the left side, but it would appear as a very small, prominent artery, very deep in the canal. So it's not exactly small, but it is incredibly deep, that can be found within the suboccipital triangle. Two other structures to be aware of associated with the suboccipital triangle are two separate nerves. First, we have the suboccipital nerve. This is a branch off of the dorsal ramus of C1 spinal nerve, which means it comes off of the C1 spinal nerve between C1 and the base of the skull, right in the actual suboccipital triangle, and then it says branches to each of the four muscles of the suboccipital triangle, so that's where they receive their innervation from. The second nerve is the greater occipital nerve, and that one's actually coming up between C1 and C2 and will actually hook underneath the inferior oblique, wrap back up, and extend to the base of the skull, where it'll provide cutaneous information to the base of the occiput.